Do anesthesiologists put people to sleep? If you have ever had a major surgery, chances are you had an interaction with an anesthesiologist. Most people who are not familiar with the world of anesthesiology and perioperative medicine usually believe the common trope that anesthesiologists are there to, quote, put people to sleep. In fact, it is not unlikely that the anesthesiologist for your case would have described it in a similar manner as well. So is that really what anesthesiologists do? Well, the short answer is not really. If the procedure simply requires you to be asleep, then it would be more feasible to just invite you in the night before, and once you're asleep, commence the procedure. For the long answer, let's jump into the differences between what we call sleep and what our bodies experience when an anesthesiologist takes the reins. What is sleep? Sleep is a natural physiological process that we spend a third of our life doing. Regular or normal sleep that most people experience consists of two states, REM sleep and non-REM sleep. Dr. Emery Brown has a great video explaining in detail what happens to our bodies during this time. But here's the TLDR. REM sleep is when your body is immobile, but your mind is most active. This cycle is when most dream states occur. Non-REM sleep is when the body is still active. Parasomnias such as sleepwalking, sleep talking, and sleep eating are phenomena that occur during non-REM sleep. Our bodies cycle between REM and non-REM during sleep sessions. Note that while we are asleep, there are certain essential activities that continuously function. Among these is a little-known activity called breathing. You know, the difference between life and death. Breathing. So what happens during anesthesia? Right off the bat, let me clarify that we are not talking about local anesthesia or nerve blocks. Those procedures are obviously not going to be confused with the activity of sleeping. So that leaves us with two types of anesthesia, general anesthesia and sedation. Let's talk about general anesthesia. The most accurate way to describe general anesthesia is the way the anesthesiologist describes it. A controlled, reversible state of 4 A's. Amnesia, analgesia, akinesia, and areflexia. Unlike sleep, when under general anesthesia, the patient does not cycle between REM and non-REM states. When an anesthesiologist has a patient under general anesthesia, they're in the most controlled state possible for the surgery. Also, due to akinesia, the patient's muscles are paralyzed. Therefore, the body is unable to breathe on its own. This is why one of the key activities that are performed by an anesthesiologist in the operating room is airway management. They make sure that the patient continues to breathe during the procedure, which, depending on the complexity of the case, may last several hours. In addition to airway, the anesthesiologist also makes sure that other body parameters such as pulse oximetry, blood pressure, heart rate, etc. are all stable and controlled. Remember that this process is both controlled and reversible. So once the procedure is complete, the anesthesiologist allows the patient's body to take back the controls, so to speak. Now let's talk about sedation. Depending on the complexity of the case, the patient's medical history, or current underlying conditions, the anesthesiologist could choose to have the patient under sedation instead of general anesthesia. The main levels of sedation are minimal, to help you relax. You'll understand questions your doctor is asking and be able to answer as well as follow directions. This level of sedation is typically used when your doctor needs you to be involved in the procedure. Moderate, you'll feel drowsy and may even fall asleep during the procedure. And deep, you won't actually be unconscious like under general anesthesia, but you will sleep through the procedure and have no memory of it. Keep in mind that the sleep described for the moderate and deep sedation is the REM non-REM sleep that we experience at night, but the drug provided by the anesthesiologist is simply initiating the sleep process. After that, your body takes over and cycles you through the REM non-REM states. There are no known drugs currently in the arsenal of an anesthesiologist that can replicate the REM non-REM cycles of the body. So why do anesthesiologists sometimes say they'll be putting you to sleep? It is to comfort you, the patient. Major surgeries are daunting, and patients are already anxious prior to them. The very thought of being unconscious or blacked out is terrifying. It might be the first time the patient has willfully surrendered control of their consciousness to someone. Combine that with the feeling of overall uncertainty, and you have a recipe for alarm and panic. If at this point your anesthesiologist mentions they'll be putting you in a drug-induced reversible coma, you're bound to focus on just the first and last words of that phrase. However, sleeping is an activity that is relatable, and dare I say, even considered pleasant by most people. When the anesthesiologist says they'll be putting you to sleep, it can evoke a sense of comfort and calm. They might even mention some anecdotes like, you're more likely to get into a car accident on the way to your surgery than actually have a complication from being under anesthesia. A relatively calm and tranquil state is helpful both for the patient as well as the surgeon. So, to conclude, anesthesiologists do not put people to sleep. At least that is not the intention anyways. There may be some cases in which sleep would be a byproduct of the drugs provided by the anesthesiologist. Nonetheless, with a good anesthesiologist around, you can be rest assured that the experience would be as easy as falling asleep. Anesthesiologists shy away from the spotlight, and more often than not, you will not meet them after the surgical procedure is successful. But if you do, make sure you thank them for keeping you alive.